saying even in order to get, well, now I can understand a sort of regulation on the plan B. When you want, shouldn't we, like in other words, do we want just teenagers and stuff just going and buying those things like chiclets? And okay, I've dated myself with the chiclets, but I'm saying
buying condoms and other things from the pharmacy. Well, if you're smart enough to do that, you're smart enough to do that as well. Absolutely, it should be unregulated. I do feel, and it is not regulated. You can go to a pharmacy and get Plan B at any point in time, without a prescription. It's just the cost of it all, and now you have, they're going to be squeezing medical insurances not to cover the cost of terminations, not to cover the cost. We just had, after Obama, we had to squeeze them just to cover the cost of certain birth controls. So, everything that we're doing to have a normal sexual health without incident is imposing costs on females in this country.
And you know what? To piggyback on what you just said, because I'm listening to everything you both are saying, the thing that also is equally as dangerous is that there is being also placed the stigmatism of irresponsibility on women, which is deeply unfair. Because now it looks like there's this culture of wild women just out here wanting to have rampant sex without any responsibilities tied to it. And that's not the case. That's not what's happening, because they're not having, number one, they're not having sex by themselves. So, they're having sex with, if they are irresponsible in the nature that they're being painted, then they're having irresponsible sex with their equally irresponsible counterparts. So we're going to paint it. Let's paint it properly. But the reality is that's not true. The truth is more in alignment with what you just said, is that while there is a sexual freedom from some women that want to do certain things, or there is a desire to have the activity without some of the added responsibilities that may come along with it, that's choices. That's just choices that people are making, and they should have the right to make those choices. Whether I agree with those choices or not from a personal perspective, it's their choices, and we have to respect the choices that people are making. Is that what I guess that's what I'm hearing you say.
Absolutely. I mean, I think about my 50-year-old woman. We're not menopausal yet. High blood pressure, diabetes, other medical ailments. They take birth control. And one day that birth control doesn't work. We're telling this 51-year-old now, who will then be 51 at the time of birth, that she has to birth this child with all of her medical conditions when she was trying to do the responsible thing with her husband. And so what are we saying in this society? I'm not going to make the choice. Some people will say, well, that's the bed you lie in, it's fine. But I think we need choices. And what are we saying? They all like to cite the Constitution of this country. But then they're saying the people that made the amendments, the people that made this law, they were wrong. They weren't wrong about other things, but they were wrong about this, and we got to fix it.
Wow. Tricky, man. It's tricky. I struggle with where we are in this country right now, because I know these are dangerous waters, because when you start overly policing, first of all, you've never truly made a decision that we really are one nation under God. So let's start with that. So now you're picking and choosing the God places. And when you do that and you choose that decision of morality to be placed on certain places but not on others, it feels wildly hypocritical, and it also feels disingenuous, and more importantly, it feels dangerous. Because if we can pick and choose when we want to be moral, then that morality goes in hand in hand with the probably with even this issue, probably goes hand in hand with financial issues that we can't even see. And right now we don't have formula. So what are we even talking about?
I think my sister said it best one day. She said, after apartheid, South Africa realized their constitution and their government, it wasn't right. It wasn't done right.
Right.
They scrapped their whole constitution, their whole government, and said, we need to do this over. We're sitting on a constitution that sees us as a piece of property.
Still.
And there's an amendment to an amendment to an amendment to an. It's flawed. We know it's flawed. Scrap the whole justice system and let's start all over. But they're talking about things that were in place before we had a real government. They're harping on things, but other things that wasn't done right. And then we'll just make an amendment. And then another 10 years, we'll make an amendment to that. Let's look at where we are as a country, where we want to be as a country. What is important to the constituents that put you into office, and just revamp the daggone justice system.
Listen.
And political structure in this country.
Oh my gosh. Listen, this facts. I had a question come in from inbox. That's why I said folks is just kind of hiding out in the shadows saying, I'm gonna watch, but I don't want you to know it's me. So let me
and men too. Men, if y'all got questions, y'all scared to ask. I'm sorry.
What
men be asking? You don't know either.
What is your opinion on vaginal acne?
Oh, well, I don't have an opinion on it, but
I said it the way they wrote it. So.
Is that a thing?
Well, vaginal acne, let me say this. That could be one of two things. Some people shave a lot and they get ingrown hairs. So that could be one thing. And when there are real issues with vaginal acne, we have to be careful that it's not something called hidradenitis suppurativa, long word, or scarring pustules that happen in the genital area. So we really want to be careful. And one thing that I always promote to young women, it's nice to wear thongs. It's nice to wear G-strings. It's nice to wear lingerie, but they weren't made to wear all day. And yes, you should wear cotton so that area could breathe. I'll just put it that way.
See, yet another reason why butt naked is always better.
What?
We had that discussion with Dr. Smith. I told her that she didn't want to.
She was strongly.
She's a PhD. She's a PhD. She don't know. I'm gonna send her this clip though.
That is.
Thank you, Dr. Welsh.
I plead the fifth on that one, but hey, if that's what you like to do, that's even better.
Well, but see, she's hearing it from an actual OBGYN. This is not her doctor is in education, so she need to hear it from a specialist in the field that said, look, it's not designed to wear all day, and you need cotton. And so cotton may not be as sexy as the slippery stuff.
Hashtag the fabric of our lives.
It's the slippery stuff. I mean, it may not be as sexy as the silk fabric. Yeah, the silk and all that stuff. But you heard Dr. Welsh say it's only supposed to be on for a short period of time.
There's a place for everything. You don't go to the gym wearing that stuff. It doesn't breathe. Listen.
Wow, that's powerful. Thank you. Let me ask you. I won't attempt to pronounce that word you said that had at least 20 letters.
Hidradenitis suppurativa.
Okay, that. How does one? Okay, I got the one. I got the ingrown hairs. I understand that. What if the other one? It just comes from having oily skin, or
very scarring pustules that will occur, like I said, in the genital area, somewhat like pimples. Some people do get it in the axilla, which would be underneath the arms as well. And when they heal and when they drain, they could be very scarring to a young female. Antibiotic creams, birth control pills, there are lots of things that can prevent that.
Dr. Welsh, why does it seem like birth control pills is the cure-all to so many things?
Because it is. It is. When you don't get your period, we give you birth control. When you're bleeding too much, we give you birth control. When you don't want to get pregnant, we give birth control. When you have severe depression, we give birth control in that cycle. And for some women that have cancer and can't undergo surgery, guess what? We give them birth control.
Oh my gosh. What is happening? What is in the pill? I mean, what is in a birth control pill that it has all these magical...
It is magic.
Okay, but let me ask this question, because I think this is the concern of a lot of people who are uninformed, as I am, in relation to birth control. Are there long-term effects to taking it towards conception? Because if you're a person that starts early in life on birth control, 15, 16, 17, whatever it is, and you keep taking it for the next 10 years, doesn't that have some effect on your body at some point?
Long-term effects of birth control: decreased chance of ovarian cancer, decreased chance of uterine cancer, decreased chance of benign cyst in the breast, decreased chance of pregnancy, decreased bleeding during your period.
What the?
But it does cause it. Yes, there are birth controls that, if taken, can cause you bloating, can cause headache, but long-term on fertility, no. And this is how I talk to my patients, because I just sat there and said, when you're taking birth control pills and you forget that one,
right,
what happens? Wow. You get pregnant,
right?
Wow.
So you could be taking it for 15 years and you forget that one. What happens? You get pregnant. Now, there is one birth control on the market that does significantly delay your fertility, and that's something called Depo-Provera. That's the injection that some women like every 3 months.
Okay.
It can take up to 10 months after you stop that last injection before you can get pregnant. But some women believe, I'm not on birth control, I'm having sex, why didn't I get pregnant this month? Women only have about a 20% chance of getting pregnant every month. And I'm going to repeat that, 20% chance. Some women feel like they have sex, they get pregnant. It's that 20% chance. And as you age, that chance goes down significantly.
Oh, Lord. Okay, so here the inbox message. So if that's the case, does it balance PMS, all of the issues that you have when you suffer from PMS?
Yeah, so there are birth control pills designed for something called PMDD, which is dysmorphic syndrome, severe depression during that cycle, the time when estrogen really goes down. So yes, it can combat some of those symptoms.
So are you saying that even when a person is, what do we call it? Once the menstrual cycle stop, menopause, you're saying menopause, in other words, because that's like our estrogen going down, right?
Well, yes, there are other pills that can be taken when you're in menopause. But here's another belief. A lot of women say, oh my God, I'm in menopause, I'm going to need medication. No, you don't. There are many, many women that go into menopause and have not a single symptom. Medication for menopause is for only those that are symptomatic. And if your symptoms are very mild, where you have one hot flash once every 3 months, you do not need medication.
Okay, that's good news.
Why are we so uninformed? I am this years old understanding birth control. Well, like today years old.
Because these are the things that they don't teach you in school. They don't want you to know your history. They don't want you to know about your body because it was always seen as taboo. And when you talk to your grandma and it's like, hey, when did you go into menopause? I don't know. They don't want to talk about it either. But these are things that you need to talk about. And I think I talked about this on one of our last shows. It's like you need to talk to your family members about their health, their sicknesses, and even menopause, because it helps us understand as we move on what we're either going to face or what we're at risk for.
It's blowing my mind.
I mean, really, because I'm saying, when we think about birth control pills, first thing you think of is, don't be out here trying to be promiscuous, because you got backup as a birth control pill. But when you start talking about the birth control pill and all its benefits, it's like it's the magic pill.
But here's the thing. I don't know if the girls who are taking birth control even know that it's doing that. I think they're just taking it because, I don't know if there are doctors like Dr. Welsh who are truly breaking it down to say, here's what's happening to you when you take this pill.
But people think of birth control as only the pill.
Right.
Only the pill.
I did.
If I tell you I use birth control, I am certainly, I want my husband to hear this loud and clear. I'm not promiscuous. I'm only with one person, but I don't want to have any more children. But I don't use pills. I have an IUD. I'm too busy to remember a pill every day. I have something that's going to last me 7 years that I don't have to worry about at all. There are birth control that you take every day, that you can take once a month, that you can do every 3 months, that you can do every 4 years, or you can do 7 to 10 years, depending on how long you want that, that protection.
Okay, now we're in another lane here, Dr. Welsh. Wow. What is the most effective birth control method?
I knew you were going to ask that.
It's funny you ask. The most effective is probably the most costly and the most underutilized. Believe it or not, the Nexplanon is the most effective. The Nexplanon insert is an insert that goes right under the skin in the arm, right in the office, and it is good for up to 3 to 5 years.
What?
Yeah. And it's progesterone only. It doesn't have any estrogen. So for women that take this, they decrease the amount of bleeding. Sometimes there's a cessation of bleeding, meaning that they don't get their period. And there's this belief that you have to. And all birth control was designed to decrease that, to decrease the chance of having anemia, decrease the chance of having heavy bleeding. And those methods really thin out the inside of the uterus so that there is no need for a menstrual period. It makes it look like a menopausal woman, more or less.
Is that more suggested for older women than it is younger, or it doesn't matter? It doesn't matter.
Doesn't matter.
For 3 to 5 years.
Yep.
Wow.
I heard about the one for 5, the 5-year woman. But I'm gonna just tell you, why do we feel? I mean, I don't know if you can answer this, or is this just why do we feel like you said that we have to have one? Like, does that because we feel like that makes us
have a menstrual cycle?
I mean,
is that what you're asking? Because
you're a woman and you're saying I have to have my cycle. Well,
I'm gonna answer that because if a woman is sexually active and she's not on the pill, the menstrual cycle is the checkpoint.
And that is exactly what they say. I don't feel comfortable if I don't get it. Then how will I know that I'm not?
How will I know? Exactly.
What if it fails? I'm never going to know. My mom said that I should, that it's no good. Then there's something, collecting inside of me. I don't want things inside of my body. Those are all the responses that I do get.
Okay.
But it's funny, outside of this country, the most widely used method are IUDs, things that are inserted in the uterus, again, in the office.
Wow.
So the IUD can be like put in and taken out
in the office.
Okay. Okay. I mean, because I don't think a lot of us are even updated on all of the options.
These options.
I know when I worked in an ambulatory care facility, and the worst thing I ever heard of in my life was that cup. And it was because somebody got it stuck and they came into the urgent care to have it. Well, it's true. They couldn't get it out and it'd been left long. They had to have it. I don't know what they did back there, but it was like a suction had built up or whatever. But when they cut it, the smell was unleashed.
When they cut it,
because
oh my God,
supposed to catch all the blood. I mean, you correct me if I'm wrong, Dr. Welsh.
Y'all got a lot going on, okay? Y'all got a lot going on. It's a lot. It's a lot. Y'all have let me behind the curtain today, and I must say I am shocked. Goodness gracious.
Yeah. I will tell you that we have become a society that makes women feel less than, makes women feel about their body parts that they're less than. Women will not touch themselves. They will not, there are birth controls that you can insert into the vagina. There are birth controls that you can insert into the vagina and cover your cervix, which you're talking about, whether it's a cervical cap or a diaphragm. Long are the days where a woman will feel comfortable with that, honestly, because it's seen as taboo. I shouldn't. And to my young patients, I say, well, if you can't touch yourself, then why would you want a stranger, me or any man, to do it?
It's true.
Ooh, Dr. Welsh, you just.
But then they tell me, well, that's your job.
Well,
no, my job is not touching you.
But their job is to tell you what's going. They got to tell you what's going on so you can know what it is. The problem. I mean, I'm not putting my children on blast. I'm just gonna say, I'm general. Is that one of them was asking me some questions and stuff, and I was like, okay, you're not gonna let me see. You won't let me see, and I'm trying to say, I'm asking you to describe what it is that you're going through so then I can help you. But he's like, okay, well, then maybe I'll describe it to the doctor. I was like, okay, so you want to go into the doctor's office and let her know all this stuff when we might have been able to save a visit if you'd have just told me what it is. Well, I don't want you looking at me. I don't know how to help.
I have a weird question, but I think it's an appropriate one at this moment. I'm a father of 2 daughters. How do I instill confidence as a father in my daughters towards not just the exploration, but the understanding of their bodies? How do I do that? What's the best way to do that without being invasive?
No, I think that's easy because I have a 14-year-old daughter as well. But understanding body parts, that's number one. It's real easy and simple to read about it in school. Well, that's what that is, and that's what that's supposed to do. But locating it on your body. When you're young, you say nose, eyes, mouth, and you want them to understand that. And we get so far as to say penis and vagina, and that's all we do.
Mm-hmm.
I will say, giving them a mirror, saying, hey, look at your body parts, understand what it looks like. So that if there's something abnormal, you can tell when it's abnormal and what it's not supposed to look like.
Okay.
I think that's the best way for them to feel uncomfortable. You guys know, I'm here for about 8 months now in New Jersey in a new practice. And in my exam rooms, I have these pictures of female body parts that I've never had before. And you wouldn't believe 40, 50, 55, 60-year-old woman. And when I'm talking about their vaginas or whether it's falling in their uterus and the cervix and what I see, and I'm pointing to these pictures, they're fascinated, like, oh, okay, that's what it looks like. That's where it is in relation to this body part, because they never knew.
And see, I was just going to say, you said we wouldn't believe it. I actually would believe it because I don't think our generation and before us have been totally educated properly as to a lot of how the body works and where things are. And we just out here guessing, man. We don't know. We like, I think it goes here. I think it's supposed to come out there. We don't know. We just guessing.
And I would assume
passing those bad guesses on down the line.
I would assume the same for a man. If I asked, 10 men to locate on a chart where the epididymis is and different body parts for the man, they know the penis and the scrotum. Yes. But everything else involved in that, it's probably a blank.
It is. It really is.
I'm going to tell you the part that I think blew me away the most, hearing. A young lady told me that she never peed with a tampon in because she thought it was the same area. that the tampon goes in the area and holds the pee in, and she's like was not aware of the 3 orifices. I was like, what do you mean that you don't?
Porn based.
No,
I'm being honest. That ideology feels porn based because there's thought processes in pornography where something's happening over here and something ain't happening over there, or it is coming out the same place. So it feels like she may have derived that theory from somebody, maybe not her watching it, but somebody telling her, oh, this does this and you're going to have this experience and blah, 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 blah. Because we don't understand any of that.
I believe it. I'll never forget having a discussion with my mom about a patient. It was a young 16-year-old who just had a baby, probably 3 days prior to her popping in the office with her partner. And they were very concerned that there was a lump down there and they wanted to make sure it was okay. So I'm looking for the lump. I never found the lump. And I said, can you point to it? And it was her clitoris. So we're at the point where we just had a child. We're having sex. And again, we don't know the proper body parts. And I told the patient what it was. And my mom kind of yelled at me that was my time to really educate. But I think I was just in shock at that point.
Right.
Flipped how I speak to patients after that time.
That's scary. That's really scary. But again, not surprising, because that's what's being passed down, or the lack of what's being passed down. We're not having these conversations, and we're not, and there are not enough doctors. And I'm not blaming doctors by any imagination, because that's not necessarily their job. So, but at the same time, if you got to be able to get it from somewhere, you got to be able to figure this thing out from somewhere. It's not being taught in school. It's not being taught at home.
Listen,
somebody's got to tell you what's going on.
We come from the man got on top of me doing his business type.
Her favorite saying. I don't know why. She's
so purple. The color purple.
It's color purple. That's what she said. The mister got on top of me and did his business. So if that's where we come from, and then you're expecting those people to educate the next generation, they're the ones that saying, everything is some type of general term and not specific. I couldn't figure out why my mother was so uncomfortable explaining stuff. And she was like, Dr. Welsh, she said, you need to go on down there to the people. See what I tell you? A general statement. Go on down there to the people at Planned Parenthood. I'll drop you off down there and they'll tell you. And they got a lot of brochures and pamphlets. I was like, okay, so you drop me off down there because you feel that they got the library to all of my questions. But I mean, I was expecting you to tell me something moral or something or whatever. She's just like, no, you need to just let them people. They got a wall of stuff down there.
But she was telling you something. You didn't know it, but she was telling you something when she sent you down there. She didn't know. That's what she was telling you. I don't know the answer to these questions.
Was that it?
Yeah.
No, I don't believe it. I'm going to tell you, because at that time, I remember my mom was going to college and I was in her books. She'd bring home textbooks from school on different things. And I was like, oh, because I was like, they ain't teaching that in school, but I was learning some stuff in her books. That
don't mean she knew, though. That just means she was in a class. You know what I mean? I've taken biology. You've taken biology. I've taken anatomy and physiology. You've taken anatomy and physiology. I still didn't know it. The stuff that Dr. Welsh has broke down to us today is brand new information.
Well, that's true too. I mean, I took human sexuality, and they still was like, refer to the textbook.
Right. We know what we've experienced. We know what we've experienced, but we don't know. We don't really know. Like this birth control conversation has blown my mind today. I'm literally processing a whole different lane from my girls right now. Like, well, man, maybe we need to go make a visit, because we could maybe head off some things just on that alone. So we don't know. We think we know, but we don't really know.
Well, if it's going to help benefit them in the way that Dr. Welsh just described, I'm saying, I guess I am old school, where I was thinking, okay, if we're just trying to sign them up for that, aren't we just giving the green light? But, but I mean, I'm just saying, that's my mindset is that, are we saying, go ahead, But then at the same time, you're saying, well, let's go over the benefits of such. But that's what they were trying to tell me when I had such excruciating, debilitating menstrual cycles. They was like, if you put her on the pill, that should slow down all of that. And I'm like, but then they said, no, after your first baby, that should slow down all of that. I was like, so I gotta have the birth control pills first. And if it doesn't make my menstrual cycles better, then having a baby will make them better. No.
I think too many things in this country, again, like I said, geared towards women are always taboo. Hormones, taboo. I can't have hormones because I'm going to get cancer. No, that's not the case. And it wasn't even proven in the big study that they did when it comes to menopausal medications that help menopausal symptoms. You know, are there a subset of patients that don't do well with birth control? I'm not saying it's for everyone. But what I do say is when it comes to pills alone, there's hundreds of different pills. If Revlon doesn't color your hair, Clairol might. And, you know, whatever other product on the market might do it. But they're all trying to do the same thing. But there's different hair types. There's different products. There's different women. There's different birth control. And for women that really do not want hormonal things, there is a non-hormonal birth control that, again, it is an IUD. It is non-hormonal. And for those with menopausal symptoms, not all treatment is hormonal. There are herbal medications. There are antidepressants. There are antihypertensives that help with some hormonal symptoms of menopause as well. So all hormones are not bad, and all people aren't made for the same thing.
How do you find more?
Hold on, Mr. Noiz. That's why I said, let me check. I forgot that I was supposed to be monitoring the inbox messages to people that are watching that don't want to put in the chat. They said, this is so informative. I think I need to get back on the birth control.
I wouldn't say to take birth control just to avoid cancer. That is absolutely what I would not promote.
Okay.
Does it decrease your chances of some of the cancers? Yes. By sheer decrease in ovulation in the ovary and decreased cycles and lighter cycles in the uterus. Yes, it can decrease your chance, but it is not a preventative. It is not used. If that was the case, we would never have cancer, right? Everybody would be taking these, but it does decrease the chance. I would say to talk to your gynecologist if birth control is actually your goal, or you're having severe issues with your menstrual cycles, or as I just had the other day, a woman who tells me right before her period, she gets severely depressed. She is a physician that's telling me I get severely depressed. I can't enjoy anything. I'm crying. And this, again, is a symptom of something we call PMDD. And it is due to the decreased estrogen in the body. And yes, at that point in time, I'm going to give her birth control because I'm going to try to regulate those natural hormones that she has in her body so she doesn't get to that point. So there are so many other benefits. And for those that just bleed very, very, very heavy, there's no reason to sit there and have a decreased quality of life, especially not sexual health. And people don't take sexual health for females as important in this country. There's no reason to bleed for 2 weeks out of the whole month and decrease your enjoyment during the rest of the month, or have severe depression for a week or two where you don't want to be touched. So we need to talk about it. And don't be afraid to talk about it with your physician. And to those that don't feel comfortable talking to your physician, get another physician.
Well, all right. Can I ask a weird question? How long on average should a period last?
5 to 7 days.
No more than 5 to 7 days. If you're having something longer than that, something is not right.
There you go.
Okay.
Question about the menstrual cycles. So our youngest, I'll just put it that way, our youngest child really has the debilitating menstrual cycles and has missed a considerable amount of school because she misses a certain amount of days, like each month. It doesn't matter.
Considerable sounds like a lot. It's,
I mean,
over the course of
each month.
Well, over the course of a year, it's, you know,
a couple of days each month equals out to a considerable amount of time.
Okay.
So what do you recommend? Is there like a standing order that can be given to the school that, you know, this is something that's beyond her control and that's something whatever, or is there a birth control? I don't want to think about birth control pill with my youngest child, but I'm saying a birth control pill that you would say for Black women. That, I mean, I know there's so many, and I'm not trying to kind of nail it down to Black women, but I'm trying to figure out
Black birth control pill.
No, I'm saying
okay. I'm just trying to understand where you're going with this.
Pill that will help with because according to Dr. Welsh, a lot of the stuff we deal with in our menstrual cycles is not something that all races experience.
Okay,
we're more. Our stuff is more intense.
Sounds as if, you know, being that she is so young and she's experiencing this at a young age, to me, it sounds like endometriosis. This is when the glands in the ovary, the glands in the uterus are sometimes outside of the uterus, and they can usually sit on the ovary. And these glands are reactive to the hormones during the cycle. So when your uterus is contracting, those glands that are implanted outside of the uterus are also contracting, and it causes debilitating pain, whether it's on your ovary, whether it's in your intestines as well. Yes, the first line that we use is the almighty birth control pill. But depending on how severe endometriosis is, some GYN surgeons will do minor surgery to remove those glands, which is a very tedious surgery, and it doesn't always remove the pain. The second line defense is sometimes using birth control that's going to stop your periods as a whole, just to give you some freedom to move about from month to month. Because again, as I said, even if the patient is 14, 15 years old and starting on birth control, doesn't mean that if she's on for the next 5 years, that somehow at 21, she's never going to have a baby. That's just simply not true.
Okay.
Wow.
I appreciate that, because first thing I thought about was, oh my, well, I don't know. I guess for me personally, I remember I'd been on the birth control pill for a long time. And then once I finally got married and was like, okay, I'm gonna stop taking the pill, so, you know, so I can have a baby, you know, nothing was popping off immediately. And it was like month after month after month. And I was like, okay, did I take the birth control pill too long?
And then what happened? You had children.
I'm grateful, because a matter of fact, it was almost 10 months. 10
you
months.
had to empty out the Kool-Aid picture, and once you did that, you were fine. I don't know.
Really, sir?
I don't know what I'm talking about. I'm a man. I don't know what I'm talking about. I'm out here in these streets putting out bad information. I don't like it.
And 10 months is not a long time. When you really want something and desire something, it seems like a lifetime. But we don't even do an infertility workup until you've been trying for a whole 12 months. And I can tell you that when I tried to conceive my son, it took almost 2 years. And I was like, oh, okay, maybe I'm menopause already. Maybe I'm going into that. I was still in my 30s. But yeah, it took 2 years.
We got some people we need to send to you to New Jersey.
I mean, listen, I'm talking about, we need to talk about catching a flight and coming to New Jersey, because
like
now all my kids are like, we need to go to where she's at, you know, like
a group road trip or something. Or maybe we just make you the national Black OBGYN doctor. I don't know. We got to figure it out.
Listen, I told you guys, I delivered my sister. I went to New Orleans and I had to do what I had to do. I'll go anywhere.
Look at that. Look at that. Look at
See,
that.
Don't be quiet, Dr. Wells. You know, we down here struggling and you all the way up there.
Listen, Dr. Wells, you know, we can keep you here. We know you got like an actual, you know, job.
I do have a job.
So you know we can't keep you here forever, but we love it when you come.
Oh my God!
Please keep coming to the show and dropping these gems. Oh my God!
Oh my God! Every time.
I hope you open up a book and learn your body parts too.
I need a book. What book would you recommend that I open up? Because I need a book or something.
You can go to any anatomy book. You can even go to Google.
I need to actually read it though. That's the problem. I think I just learned enough to pass the test. I didn't really.
I know you did.
Yeah, I didn't actually study it at all. Like I was like, whatever. I just need to memorize the system, and that way I can point it out when I need to. But I don't remember none of it.
I appreciate you letting that be known, because I felt kind of some kind of way when I just, my daughter was asking questions. I was like, look here. And I pulled it up on Google and said, okay, here is the diagram. This is you. I mean, because I was like you. I can't tell you what's going on if you can't explain it to me other than, but because see, like I told you, it's the general words that our parents taught us, something's going on between my legs. What is that? What does what are we talking about?
My children to the dentist with me so they can feel comfortable with the dentist, right? When they were little, when they were 2 years old, they sat on my lap and they looked to see what they were doing so that their next chance was to be in the chair, and they felt totally comfortable because I did that. Nothing wrong with taking your daughter into the gynecologist with you.
There you go, Kia.
That doesn't mean that they have to stand at the foot of the bed, but they can always stand behind you. They can hold your hand and see nothing. But if you feel comfortable and show her that you're comfortable, then they'll feel comfortable in return.
There you go, Kia.
You have to guide them.
You need to bring him to the doctor with you.
No.
Dr. Welsh, thank you so much. We love you. Thank you so much.
We did.
Coming through.
Thank you guys, and enjoy. It's been a pleasure.
All right. Ladies
Have a great day.
Ladies and gentlemen, the incomparable Dr. Tia Welsh.
Bye, everybody.
Oh my goodness. She's so good. She's so good.
Her rapport is incredible.
Here's what we gotta do. We gotta do everything we can do to make what she does known to more people. They need to hear her. She makes it palatable, and she makes it understandable, and she makes it real and tangible. So you can feel it, you can touch it, you can experience it.
I wonder, what's the male doctor for? I mean, I know she's an OBGYN, but is OBGYN just kind of limited to, in regard to the information with
probably
with men?
Well, I'm sure she has a general knowledge of men and what we go through, but it would be.
I mean, do you guys have a penologist?
I've never heard it referred to as that, and we should probably never refer to it as that again. I mean, the hell? What are we doing right now? I don't even know what we're doing. But we do. But I get your point that we need a counterpart to that thing that you. Let me do a couple of quick announcements real quick, because we got and we're gonna have this show replay tomorrow because people need to hear this again. This was just really good information. But tonight we got the 5. We coming through to talk NBA finals and NBA free agency and some other stuff. So y'all make sure y'all come through. And then Believe in the ACC is tomorrow, so don't miss that in the morning. Believe in the ACC. That's tomorrow. And then I'm going to replay also that Talk That Tuesday tomorrow, so you'll get a chance to see that. And the reason I'm doing it because tomorrow night we're going to have the part 2 of Talk That Tuesday, the conversation that we had, very good conversation that we had last night. So you don't want to miss that as well. So a lot going on, a lot to share with the peoples.
Oh yeah, because people are like, they want to know, can they start following her on Facebook, and they want to know how they want to make arrangements to get pay her for consultations, and and all of that type of stuff.
I think you should follow her, and I think
she'll let you know how she can,
yeah, she's got all her contact information. So yeah, we can make that happen.
Mm-hmm.
But yeah, listen, great show, Mama Noise. Great job as always. Proud of you. Glad that we're gonna get these vaginas straight in this house.
You know what? Noisemakers, I appreciate y'all hiding out in the shadows. I was happy to relay y'all.
Y'all should have came out and asked the question. I can come on. Why y'all embarrassed to ask the questions? Just ask the questions. We all got questions. I ask my questions.
Yeah, but what's it say? Okay, thank you. I appreciate you giving me some credit because Mr. Noise, he be trying to come in trying to take out.
I gave you the credit.
Although, see, they were wondering too if there's a such thing as a penologist that that just specializes in the penis.
I'm not going there with you. I'm not going there with you.
I'm just saying we have a gynecologist that specializes in the.
I'm gonna be honest with you. We failed white organist because he needed this information. If he had got this information earlier, maybe he wouldn't be in the situation that he is currently in, and now he's got to have. And I found out the gender reveal party is this weekend.
Oh, really?
It's this weekend. So for those of you who are interested, just inbox Mama Noise. But he's registered at Liquor Barn, Condom Sense, and Lifeway Christian.
Oh my gosh!
Shout out to white organist who stepped up
and listen,
try to do the right thing.
Hey guys, if you really appreciated today's show with Dr. Welsh, we can also post her past show that she was on the show as well. And I'm sure combined with the information of her first appearance, I think she's been on like 3 times. Has it been 3 times she's been on the show?
3 or 4. It's a lot.
But I'm saying that any information that you need, check her out on the several times that she's been on the podcast, and people are asking, like I said, to follow her and things like that. I'm sure that she would love that. That you're that you appreciate her gift, because I mean she is the chief OB-GYN up there in
New she running that thing.
I'm ready to take a flight. I'm ready to catch a flight with my kids and my husband.
Yeah, I'm gonna sit down near your legs when this is all.
What?
Over. The girls can sit up front. I'm gonna sit down because I want to see what's going on.
Joe nasty.
I just want to ask questions. It's not nasty. It's education.
Yeah, you want to catch me when I'm in them old metal stirrups?
I definitely want to. You know what? We should end this show. We should end this show right here. Listen, we love y'all. Find us tonight. Don't miss it. And also, we'll be see y'all tomorrow morning for Believe in the ACC. This show will repeat. Last night's show will repeat. All that. You'll just know your noise schedule. Come holler at your people. We love y'all. Thank y'all for pulling up. Peace.
We're talking.